Hatvet PHARMA welcomes you to the ocean of practical knowledge about small animal practice, that is, Hatvet's YouTube channel. We are thankful to our honorable speaker and session moderators for sharing their valuable time and knowledge with us.
My dear friends, Namaste and welcome to our webinar. And our today's topic is abnormal micturition in dogs and cats. This is a very important topic as we, the pet clinicians, are considered. And when we are concerned about our pets' issues, this makes one of the major issue in our clinical practice. We know we have a lot of feline patients in our clinical practice, and we do encounter a lot of urinary problems, especially with Persian cats. Why these Persian cats are having this much of urinary problems? The main problem we very well know is that they are deprived of water, drinking water. So we all know that a cat or a dog should drink at least 50 ml per kg per day. That should be the drinking water dose. If it is not getting this much of water, either from the food or from the drinking water or metabolic water, whatever it be, these are the three major sources of water in the body. And so if it is not getting that much of quantity of water sufficiently to maintain the metabolic activities, unfortunately, all the urine will become concentrated, the chemical molecules will become precipitated, and stones can form. So we have a lot of abnormal urination, abnormal micturition in dogs and cats. I'm going to enumerate and elaborate the most common micturition problems in dogs and cats. And when we are dealing with urology, there are certain technical terms which we should clearly understand. There are certain misunderstandings regarding certain technical terms that I'm going to explain each and each. See, according to the type of flow, we have a lot of technical terms like dysuria, stranguria, pollakiuria, incontinence. We know the dysuria means very difficult and painful urination. Stranguria is almost like the same, difficulty in urination, but in dysuria, it will be too much straining, and stranguria, that much straining may not be there. There's only a slight difference between dysuria and stranguria. I'm going to elaborate all those things. And pollakiuria means dribbling of urine for frequent urination, dribbling of urine. Incontinence. See, this is a technical term which is used among our veterinary doctors as difficulty in urination. I've seen even in one veterinary college, I have seen this. The professor in a veterinary college has written that the cat is having urinary incontinence. It has not passed urine for the last 5 days. Because accidentally she thought that it is due to the incontinence means difficulty in urination or cessation of urination, blockade of urination. So this is what I said as a misleading term, like incontinence. Incontinence means free flow of urine. Urine is flowing out without any hindrance. Okay, that is urinary incontinence. Continuous and simple flow of urine without any hindrance. Nobody is stopping it. Nothing is stopping it. Then according to the volume of urine, we can have so many technical terms like oliguria, polyuria, anuria, etc. Oliguria, we all know the reduced amount of urine, reduced quantity of urine. We are going to elaborate it. Then polyuria means increased quantity of urine. Anuria means no urine at all. So we are going to elaborate each technical term. Then according to the material presented in the urine. The urine has so many salts, minerals, proteins, cells, all these things are there in the urine. According to the more amount of protein or according to the more amount of solid substance or the solutes or the materials present in the urine, if it is an abnormal urine, we can term it as pyuria. Pyuria means presence of pus cells in the urine. Not only 1 or 2 pus cells, it is normal, but more than 10 per 10 or 8 or 10, it is abnormal. It is pyuria. It is a clear indication of a urinary tract infection. Hematuria, presence of RBCs in the urine. Hemoglobinuria, presence of split RBCs, thereby hemoglobin is coming out and mixing up with the urine. It's hemoglobinuria. Crystalluria, presence of crystals in urine, maybe urate crystals, calcium oxalate crystals, struvite crystals, whatever it be, urate crystals are there in urine. Glycosuria, presence of glucose in urine, and we know when it happens. Proteinuria, presence of more amount of protein in urine. So, in human beings, a slight quantity, a small quantity of protein can be presented in urine, which is normal. But in the dog, if at all it is 1 plus, we have to consider it very seriously because that always indicates a kidney problem or early kidney problem. That's an indicator. Then ketonuria, presence of ketone bodies in the urine. Normally, a very slight amount of ketone bodies can be found, but more amount of ketone bodies found means it is the secondary stage or tertiary stage of diabetes mellitus, can be ketonuria. Then myoglobinuria, when there is excessive distraction of the muscle fibers, there will be a release of myoglobin from the muscle fibers, which will be filtered through the urine. We call it as myoglobinuria. For example, we know about the Monday morning sickness in horses. They have a rest day on Sunday, and on the Monday morning, they will be taken out for a rigorous exercise, and after rigorous running or exercise, their heavy skeletal muscles will undergo necrosis due to violent contractions, and due to this necrosis, there will be tremendous release of myoglobin, which forms brown urine in the horse. The same thing happens in spotting dogs also. Sometimes it will be on duty, it will be on holidays for 2 or 3 days, and after that, the spotting dog will taken for a spot. It will be advised to run fast. For example, they will be taken for a race. The same thing will happen. We can call it again a Monday morning sickness in a dog. And according to a specific gravity, where certain technical terms are there. Isostenuria. Isostenuria means this normal specific gravity. The normal specific gravity can be from 1.020 to 1.050, etc. So if it is below 1.2020, we can say it is hypostenuria, low specific gravity. And if it is above 1.07 or 1.06, we can say it as a hyperstenuria, that is increased specific gravity. And if it is within the range between 1.02 and 1.05, we can say it is isostenuria. It's a normal specific gravity. So one thing we have to mind is that specific gravity is a very important factor when we consider nephrology or urinary tract studies or even metabolism, whatever it be. See, normally male dogs, they will not squat down. In normal dogs, they will not squat down. They will, on standing position itself, they will lift the hind limb. What is the hind limb? They will spray their urine onto a stone or any object they smell and identify that it is their place for urination or it is a place for marking their territory. So that is what is happening on dogs on normal basis. The same thing happens here also. It's a dog which is urinating on a place where it regularly urinates. And the females, they will squat down. They will squat down and they will urinate. If a male is squatting down and urinating, we know that there is difficulty in urination. There is dysuria. That's a classical sign of dysuria. Maybe urinary tract infection, maybe stones in the tract. And we have to find it out. Now, we have to think about dysuria and stranguria. So, as I said earlier, dysuria and stranguria are two technical terms which are closely related. So both of these can be, there is a slight difference. We cannot clearly say which is dysuria, which is stranguria. Both are almost the same. So painful, difficult, straining type, frequent, uncomfortable micturition is dysuria or stranguria. And the stranguria is little bit less hazardous than dysuria. That is all what we tell as a difference between dysuria and stranguria. The dog will be straining to urinate, or the cat will be straining to urinate, and it will be crying, it will be vocalizing. We know, see our patients vocalizing too much, crying during urination, excessive licking onto the urogenital areas, passing small amount of urine or even inappropriate urination. Wherever they find, sometimes they urinate. That also happens in this urine strangury. And sometimes the males, they will squat down and urinate like a female. That also can happen in dysuria or stranguria. And the dysuria or stranguria is caused by various issues in the lower urinary tract. See, if it is the issues in the upper urinary tract, nothing will happen. Dysuria, nothing will happen because it is in the ureters. If at all one ureter is blocked, the other ureter will function. One ureter is off, then hydronephrosis occurs. Those are all secondary things. Those are all things which are diagnosed later only. Hydroureters, then hydronephrosis, etc. So let it be there. I'm not going into all the details of all these things. This is caused by various issues in the lower urinary tract, including the urinary tract infection. Due to urinary tract infection, sometimes the urinary tract, especially the urethra will have spasms. If the urethra is too narrow, spasms itself can block the urethral passage. The stone inside, it can block the urethral passage, producing dysuria. Bladder or urethral inflammation due to chronic inflammation can result in hypertrophy of the urethral mucosa, producing stenosis or strictures of the urinary tract, or even sometimes tumors, for example, polyps inside the urethral tract. TCCs, transitional cell carcinoma, all these things can happen. These are all very common things which we used to encounter. Cystitis. Cystitis is nothing but the acute inflammation of the bladder mucosa. We know if there is a bladder mucosa inflammation, this inflammation will be extending into the urethra also, producing a urinary blockade. Urethritis, cystitis, urethritis, etc. are all generally employed or coming as a whole. It's coming in combination. Urethral stones, etc. can produce obstructive urethropathy, producing dysuria. There will be severe pain and spasms in the urethra. There will be blood drops in the first stream of urine, indicates urine. See, by this we can say where this problem is. If the blood is coming as first few drops and then clear urine, it indicates urethral stones. Urethral stones in the anterior urethral tract. If first flow of urine is clear and at the end there are 2 or 3 or 4 drops of urine, it indicates either kidney stones or ureteric stones. And if it is blood mixed urine is coming out, we can say that the bladder has stones. And this is very common, the bladder stones. As when the bladder stones are there, see these bladder stones, especially in struvite, it will be having edges, sharp edges, or even urate crystals. They have sharp edges and they may traumatize the urinary tract or the cystic mucosa, producing hemorrhages. How will we identify the cause of dysuria? By clinical examination, of course, by clinical examination, there will be distended bladder, and you see from the physical examination itself, we can see that there is a distended bladder. You are not pressing it, we cannot see that the urine is going out. Sometimes you can see small drops of urine coming out. So there is an obstruction somewhere in the urethral tract. As I said earlier, can be the urethral spasm or the stone or the tumor, whatever. Then conduct a CBC. Of course, if it is an acute UTI, there will be elevation of neutrophils, neutrophilia will be there, leukocytosis will be there. Sometimes even acute infections, there will be neutropenia. So all these things can be seen. ESR will be elevated. X-rays. X-ray is number one. Through X-ray, if it is a calculus, we can see it clearly, especially struvite crystals, which makes almost 50% of the stones in dogs. So X-ray is very important. Then ultrasonography. If you are proficient in ultrasonography, you can do ultrasound and you can see the bladder stones or even urethral stones. From the bladder, through the neck of the bladder, we can trace the urethra to a certain level until sometimes you can see the stones if it is in the proximal areas. I have seen it. Then the prostate can be scanned in USG. Sometimes there will be prostatitis, and due to prostatitis, there will be spasms of the urethral tract that can produce dysuria. See, the prostate inflammation, sometimes if there is a prostatitis and there is enlargement of the prostate, for example, there is a BPH, benign prostatic hyperplasia. It is not like in human beings. In human beings, both the prostate, the left and the right prostate has a very thick or a very strong isthmus, and the urethra is going in between. And when there is enlargement, the even enlargement will be pressing the mediastinal areas or the median areas, and it will be completely pressing the urethra, producing dysuria or prolacuria. But this actually doesn't happen in the dogs because the isthmus or the connection or the band connection between the prostate is not that much prominent and strong enough. So it cannot happen. Otherwise also it grows outwards and will be coming up to fill up the pelvic cavity to produce constipation in prostatic hyperplasia. Then other identification is catheterization. If you are not able to catheterize, we can perform cystosynthesis. So cystosynthesis is very commonly done and it is very easy also, provided all the sterile precautions has to be taken. Then urine biochemistry, after cystosynthesis or after catheterization, the urine can be taken for biochemistry, for knowing all the physical characteristics, the microscopical characteristics, cytology, biochemistry, etc. Presence of cells are cast for identification of infection and bladder neoplasia. This is what we study through the urine biochemistry. Then how will we manage dysuria stranguria? Whenever you get a case of a dysuria stranguria and if you feel that the bladder is too much distended, the first thing that we have to do is relieve the urine and nothing other than that. Relieve the urine, that is the first thing. Catheters can be used in the male or the female. So in the male it is very easy, especially the dogs, it is very easy to pass the catheter through the urethra, to the penile urethra into the bladder. We can easily do it. And if there is a block, of course it will block up and we cannot pass it through. But in the cat, in the tomcat, it needs a tom catheter itself. FG3 and FG4 are available, we can use according to the size of the cat. But in the female dog, it is little skillful. We need certain skill and experience by which we will have, I know I will show the picture, by which we have to insert the first finger, the forefinger of the left hand into the vagina, We had to feel the external urethral meatus under the finger. We have to guide the flexible catheter, that is a pediatric feeding tube, slowly under rotating fashion. You can insert into the urethritis. See, once you are getting an experience, you will become skilled. That clearly I can say I am that much skilled. See, confidently you do it. It is actually very easy. But it should be well lubricated and lubricated with the 4% lignocaine jelly. So it can be done. So in the female cat, it is extremely difficult. We cannot attempt even. So in the female cat, we can go for cystosynthesis. Even the male cat, we can go for. I used to go for cystosynthesis only if the bladder is too much distended, because that should be our aim, first aim. The first thing that we have to do is relieve the urine. Then flushing the urinary tract. If it is a catheter used, then we can flush the urinary tract with IV fluid therapy. Go on with IV fluids. It is, the system can be flushed. If you are not able to catheterize, okay, then go on with IV fluids. After some time, the bladder will get filled up, and again puncture the bladder. And daily you can puncture the bladder for 3 or 4 days. So you can see, I used to do all these things, especially in the case of FLUTD, in feline lower urinary tract disorders. Either you can use a Tom catheter, or if the Tom catheter is not adhering due to a block, you can go for cystosynthesis once in 2 days. So that can be done. So flushing of the urinary tract, that is a flushing. Then antispasmodics such as dicyclomine. Dicyclomine should not be used in cats. There are a lot of drugs which are contraindicated in the cat. See, I have another class, I have another webinar where I used to describe all those drugs which should not be used in cats. Drugs contraindicated in cats. A lot of drugs are there. And drugs used in cats with caution. So dicyclomine can be used in dogs as an antispasmodic. Even we can use this hyoscine. Then antibiotics should definitely be given because there is definitely a chance of urinary tract infection. Antiemetics, there will be, see, why vomiting occurs? Vomiting occurs due to different reasons. See, I am in my webinar on vomiting, I used to describe all these things. Central vomiting, due to direct irritation of the chemoreceptor trigger zone. Or the floor of the third ventricle, the emetic center. So from the emetic center to the chemoreceptor trigger zone, messages will be passed. So messages will be passed through dopamine. Dopamine channels are there, serotonin channels are there. We can even block the dopamine channels, dopamine antagonists, for example, metoclopramide or phenothiazine derivatives like phenothiazine, prochlorperazine, trimethazine, promethazine. All these things are phenothiazine derivatives which can be used as dopamine antagonists. So also domperidone. There is no injection available. Domperidone, it is another dopamine antagonist. All these are prolactin agonists. We know very well because for agalexia in bitches, newly well-put bitches, the best drug is all these antiemetics. Because all these antiemetics just now I mentioned are dopamine antagonists as well as prolactin agonists. So they can increase lactation. So that is another thing. Or we can go for serotonin antagonists like ondansetron, granisetron, etc. Ondansetron is a commonly used one. We know the dose and everything. I'm not going to mention all those things. So antiemetics can be used. NSAIDs, there is pain and intense inflammation. We can go for NSAIDs or even opioid analgesics can be used. For example, tramadol, 4 milligram per kg. Tramadol is buprenorphine also can be used. Tramadol is the best. That's what I'm using. Tramadol. Then retrograde hydropropulsion can be done performed. See, it is not so easy because the surgeon's two fingers are necessary for this. One finger is for the closure of this penis, penile urethra, and one finger should be inserted into the anus, and we should press or compress or block the urethra which can be palpated or the penis just distal to the prostate. We can palpate it and we can press and close the urethra. So while somebody should be first of all introducing the tube, pediatric feeding tube into the penis, and then forcefully we have to inject some saline, closing the close here and close here very well, so that the water will be trapped inside, and when it acquires a big pressure, immediately can abruptly open it so that everything will be flushed into the bladder. I have done it several times. It's a very interesting thing, but we need 2-3 technicians. That's the only disadvantage of it. And we need certain skills. How all these skills are we are getting. It's only out of experience. Continuously do it, perform it, and we'll get experience. That if everything fails, no urine is going at all, and the block is still there, the stone is there in the bladder, a big stone can be seen on an X-ray and ultrasound, go for urethrotomy. Especially the urethral stones can be located immediately caudal to the os penis. So making an opening on this area will immediately relieve all the stones out and it will be gushing out, or the urine will be gushing out. We might have seen several times. I have encountered it several times. I've done so many urethrotomies. And so we can do this urethrotomy and we can feel ourselves relaxed. Then laparocystotomy. We can go for, if there are bladder stones inside, we can go for laparocystotomy. Then we can go for even tube cystotomy. In tube cystotomy, we are using a Foley's catheter, which is kept inside the bladder, inflated, as it is keeping the tube is kept out, and the urine is flowing out. And as when slowly urine is coming out through the penis, of course, its flow is good enough, we can simply from outside itself, we can simply pull it out. After deflating it, we can pull it out. So we can do it, tube cystotomy. That also is very commonly done. You can go for tube cystotomy, we are using a Foley's catheter. But frequent digital palpation. See, sometimes in the college, so many students will be there, they will be palpating all the time, continuously, one after the other. They will be palpating. At last, what will happen? The distended bladder, it is becoming over distended. You feel too much of pain also. And sometimes due to palpation itself, the bladder will burst. Once the bladder bursts, what will happen? The urine will be flown out. The urine is a chemical, it is a chemical solution. It's not a suspension, it's a chemical solution. It contains a lot of solutes, contains uric acid, then urea, it contains ammonia, it contains this potassium, contains sodium, so many salts, bile salts. So all these salts can irritate the peritoneum, producing chemical peritonitis. It is very serious. So bladder rupture means it is so serious. So we'll have to gently palpate the bladder, not press too much. Then identification of the crystal in the urine. That is also very important. We need certain skills for identification of the stones. So that I am coming. How to identify the crystal in the urine and the common crystals in the urine, or stones extracted from the urine. Sometimes stones will be falling down. It can be collected, it can be crushed and examined to see what stone it is. And safeguard the kidneys against ascending infection. See, ascending infection means infection ascending towards the kidney, producing septic nephritis. This has to be prevented by appropriate IV antibiotics. This is the procedure of retrograde hydropropulsion. You can see with the right hand the surgeon is doing. There is a prostate, there is a bladder. Now you can see immediately distal to the prostate, he is pressing the urethra. Manually he is blocking the urethra. The ischium bone is here. Over the ischium, you can simply press and you can block the urethra here. At the same time, the surgeon's left hand will be holding the penis like this. And one technician will be putting one before holding this penis, before closing this penis, we have to introduce one pediatric feeding tube or a urinary catheter inside, and it should go beyond the level of the os penis. And after that, the left hand of with the left hand of the surgeon will pull out the penis and press it and block it, so that while the saline is plunged or pumped into forcefully, it will not go out. So it will be, see this, the urine will be here only, the tract here only. See this tract. It will be sent or it will be collected in this tract up to this level only, because we are blocking this level also. And when it is attaining good pressure and the urethra becomes dilated, see the stones are there. When urethra becomes dilated, abruptly from you release the right forefinger from here. See the right forefinger which is blocking this area. Abruptly, ekdam, you release this forefinger, so that immediately the urine, the saline will flush into the bladder. But it is mandatory that before performing, always before performing uretro-retro-hydropropulsion, we will first of all we will have to relieve all the urine from the bladder. Otherwise, what will happen? Already the bladder is filled up with the urine itself, and again you are injecting lot of saline from outside. The bladder will become over distended and it will be ruptured. And so, first of all, by cystosynthesis itself, remove all the urine and then only perform this. That is hydroretropropulsion. So this is how you introduce the left forefinger, and this is the external urethral meatus, a female dog, and this external urethral meatus, you can feel it. A depression can be felt here, and underneath this finger you can carry this catheter. Now, normally we are using the pediatric feeding tube number 8 or number 9, or we are using number 7 or 6, even a Shih Tzus and a Pekingese back and forth, we should use number 6 pediatric feeding tube. So this can be taken under slowly by rotating movement. It can be introduced into the urethra. Urethra is so too short, and now here also we have to do one thing. We have to be very specific that our finger is well lubricated with 4% lignocaine jelly, and this catheter also should be well lubricated. Then only can easily passed. That is the Foley's catheter, where you can see the bulb here. There's 2 channels are here, and the 2 outlets are here. One outlet is for the urine drainage part, other outlet is for the balloon part. That is, air can be pumped up and this balloon can be inflated. And this is what I am using. I am using is a pediatric nasogastric feeding tube, and generally used by all of us. And these are the commonest crystals found in urine: calcium oxalate crystal, uric acid crystal, then struvite crystal, cysteine crystals. And the commonest is the struvite crystals, because almost 50% of the crystals found in the urine are struvites. These are struvite. That's the typical shape. A typical shape you can see, and there is only one stone which is having this shape, that is struvite. And this is a crystal, and when the stone comes, the stone just look like this. This is a struvite stones, and struvite stones, they comprises 50%. And these are the urate stones. You can see the urate stones are nothing but uric acid salts. What is uric acid? And then we are coming. Urates, these are the urate stones. These are the calcium oxalate stones. Just see how the calcium oxalate stones look like. We are coming into the details. First of all, we are taking Struvite stones. About 50% of the canine bladder stones are Struvites. Of course, there is no doubt in it. Struvite stones are made up of magnesium, ammonium phosphate is the most common type of bladder stone in the dog. Magnesium, ammonium phosphate, they are phosphate stones. Magnesium, ammonium phosphate. Formed from magnesium, ammonium, and phosphate. And they precipitate, this is the main important thing, they will precipitate in an alkaline urine. So whenever there is a chronic infection, the bacteria, urease producing bacteria will be there, ammonia producing bacteria will be there, they will be producing ammonia, and urine becomes alkaline, and in this alkaline media, phosphates can precipitate with ammonium and magnesium producing struvite crystals. And struvite crystals can conjoin together to form a struvite stone. That is how. So the main root cause of struvite stone is a chronic urinary infection. So in a struvite stone, we have to treat urinary infection well because there will be a chronic hypertrophic cystitis. That's what I have seen in every struvite stone. And another thing, they can well precipitate only in alkaline media. In acidic media, they cannot precipitate. So, my dear friends, I'll ask you one thing. Generally, with all our practice, it is a clear notion, it is a common notion among most of our veterinarians. If there is a urinary tract infection, immediately start citralca. Citralca is a urinary alkalinizer. 50% of the stones are struvite stones. So if we use citralca in struvite stones, what will happen? It will aggravate the condition. So never, my dear friends, you should be very cautious whenever there is a cystic calculus. You have to find out whether it is struvite stones. And struvite stone is the only stone where urinary acidifiers should be used. And this is the commonest stone also. So urinary acidifiers should be used commonly. That is what I want to say to you. Not urinary alkalinizers. You throw off these urinary alkalinizers. And alkalinizers should be used in the rest 50%. Okay, they are coming. See, dogs fed with a large amount of phosphorus and magnesium in urine, they are prone to struvite stones. We can say which is the most phosphorus rich food that we give to the dog. It is nothing but the meat. Meat is each and every meat. The mutton or the chicken or the beef, whatever it be, they are rich in phosphorus. So heavy meat eating dogs, they can produce struvite stones. That is what we want to know from this webinar. So it is diagnosed through urinalysis, X-rays, ultrasound, etc. Treatment involves antibiotics, very normal because a chronic urinary tract infection will precipitate formation of struvite stones. Dietary changes. What dietary changes? Whenever you find a struvite stone in a dog, you should advise the dog owner you restrict the meat because meat is rich in phosphorus. Restrict the meat. Got it? So we have to find out protein sources. You know, protein source is very important in the dog. What is the normal protein requirement for the dog? It is 2 grams per kg per day. So suppose it is a 20 kg weighing dog, they need 40 grams of protein a day. And meat is having 18% of protein. So other than meat, what type of protein we will have to give? So no meat or less meat. The other meat, so give only 25% of the meat. The rest can be met with eggs. Egg is a rich source. One whole egg contains 6.4 grams of protein. You can go with egg, which is it is a good source of protein. So these are the animal proteins or milk. 3.5 to 4% protein is there. Soybean chunks, they contain 18% protein. Maggots contain 50% proteins. But who will give maggots to animals? Maggot is the material which is having the highest amount of protein, contains 50% of protein. So if you are able to give maggots in large quantities to our pet, it will be excellent. But from where we will get that much quantity of maggots? So leave it. Just I mentioned that, sir. So treatment involves antibiotics, dietary changes. Of course, we studied about dietary changes to reduce mineral intake or surgical removal of the stones. Of course, we can go for urethrotomy or laparocystotomy. Diets which is low in magnesium and phosphorus, especially phosphorus, dissolve the struvite and prevents the recurrence. Encouraging the dog to drink more water. How can we encourage? We can give certain appetite stimulants to increase the thirst. Of course, it can be done. Or even some sort of, see, what I used to do is, for encouraging drinking water, I used to give 3 to 5 days of shots of corticosteroids. Corticosteroids will produce polydipsia. See, that is a trick which we can do. Or even I used to go for methylprednisolone tablets for 5 days. Just for 5 days, it will produce severe polydipsia. It will drink more water. See, those are the tricks which can be done in urinary tract infections. Otherwise, if it is a human being, we can say the human being to drink more water and to flush the urinary tract. Then the treatment, this already I have told. Never use urinary alkalizers such as citralca in struvite stones. The condition will aggravate. Only acidify the urine. How will you acidify the urine? What I am using is vitamin C. Vitamin C 500 gram per day. 500 milligram tablets are available. So vitamin C effervescent tablets are also available. So we can give all these things. Then, well, reputed companies, they market certain things like methigel. Methigel is a gel contains methionine. Methigel. It's a gel containing methionine. Acid urine. This is another, I'll show you the pictures. Uri balance is very commonly available. Another supplement containing DL-methionine. Then the commonest apple cider vinegar. It can be diluted 2 times and then it can be fed to the dog. It can acidify the urine well. Then the commonest vitamin C tablet. It's available as 250 milligram and 500 milligram tablets. Since apple cider vinegar can be used, double dilution, Uri balance paste, then this DL-methionine paste is there. Methigel of betaconol. This is very commonly available all over the world even. Acid urine. This is from the Apex Pharma. Acid urine tablets. Then urate stones. So this next is urate stones. Urate stones are composed of monobasic ammonium sulfuric acid. See, this has a story to tell. Why urate stones are occurring in Dalmatians and English bulldogs, especially in Dalmatians. See, there are certain differences between some breeds of dogs. What will happen when protein is consumed? When protein is consumed, of course, the protein will go down and the protein in the intestine will be split up and then it will be divided to its small units known as amino acids. These amino acids will be metabolized and the end product of amino acid metabolism is known as a purine metabolism, we can say. End product of amino acid metabolism is uric acid. And uric acid is highly acidic and toxic. And the uric acid has to be detoxified. This is generally detoxified in the liver by the enzyme uricase. And this uricase, this is what is happening in all dogs except Dalmatians and also human beings. Human beings also the same thing happens. All dogs except Dalmatians, the same thing happens. But in Dalmatians, they have only less amount of uricase in their liver. And so, uric acid cannot be detoxified too much. But the uric acid cannot be collected in the system like that because it is toxic. So the toxic uric acid will be converted to toxic allantoin, and the allantoin will be excreted through the urine. And the uric acid level in the Dalmatian will be normally slightly high. And so this uric acid, it is an acid. Ammonium can act with this uric acid, producing ammonium urate. This is the stone, urate crystal, the urate stone. It is nothing but the ammonium urate. And so, in which breed this usually happen? In Dalmatian. So, my dear friends, if you want to know these steps clearly, you listen to my talk so many times. The formation of urate crystals in Dalmatians or English bulldogs, especially in Dalmatians. It's a metabolic defect. This can happen in proper systemic shunting also. Circulation bypasses the liver so that uric acid cannot be converted to urea, detoxified to urea, and the uric acid will be circulated, and ammonium will be reacting with the uric acid, producing ammonium urate, contributing to urate formation. Urinalysis can be done for diagnosis. Abdominal radiographs can be taken. Ultrasound can be done. Affected dogs. So, see, this is uric acid. So, this will precipitate only in acidic conditions, not like the struvite. Struvites precipitate in alkaline conditions. Here it precipitates in acid conditions, acidic conditions. So, here for the treatment, alkalinizers are used. Affected dogs can be maintained on low purine diets to prevent the formation of stones. Okay, there also you can say low protein diets. Encouraging increased water intake to dilute the urine and prevent stone formation. And another thing is that uric acid formation can be prevented, or uric acid accumulation can be prevented by xanthine oxidase inhibitors. One of a common xanthine oxidase inhibitor is allopurinol. It is available as 300 milligram tablets, very commonly used in uric acid gouts in human beings. The dose in the dog is 15 milligram per kg twice daily to reduce uric acid levels in the blood. This can be given to the Dalmatian. And even the alkalinizers, not acidifiers. Citralca. Acidifiers are given only in struvite stones. Here, urinary alkalinizers. Then surgical removal, hydropropulsion, all these things we can do. Urate stones are likely to recur after treatment. So, ongoing management is necessary. Reduced urine metabolism, then administration of this xyluric, this allopurinol for a very long time has to be done. Otherwise, when you stop it, in 2-3 months again stones will be formed. This is a problem with urate stones. But the overall prognosis in urate stones is good, it's generally positive with appropriate management. This is allopurinol is very commonly available in our pharmacies. 300 milligram tablets, 15 milligram per kg BID. Then our citralca, we know, disodium hydrogen citrate, urinary alkalinizer. There are other stones like I'm having a common a collective story of other stones like calcium oxalate, cysteines, etc. Calcium oxalate stone management are like urate stones only. Go for a low calcium diet. If it is a calcium oxalate stone, calcium supplements, etc., should not be given. Calcium tablets, all these things should be restricted absolutely. Otherwise, this will precipitate very soon. Then other thing is urinary alkalinizers. I said urinary acidifiers are used only in struvite stones. Then next is cysteine stones. If it is a cysteine stone, 98% or 99%, 98% of cysteine stones are seen in the male, and only just 1 or 2% is seen in the female. And many cystine stones unfortunately ready loosens. Here also you can go for urinary alkalisis. Then we go for pollakiuria. Pollakiuria means increased frequency of urination. See, you're dribbling of urine, urinating severely kind continuously, dribbling there, dribbling here, dribbling there, continuously urinating. That is pollakiuria. It's very commonly found with UTI, urinary tract infection, in dogs as well as in cats. Increased frequency of urination, dribbling in drops or flow. That is sinusocystitis, erythrocystitis, or prostatitis. Everything, whenever you go for diagnosis cystitis or urethritis or erythrocystitis or ureteritis, you should scan the prostate also. Prostatitis is very common in dogs. I've seen it several times, especially when there is a chronic UTI. Infection or migration of infectious agents by contiguity from the urinary tract, it can jump into the prostatic duct. Through that, it can enter the prostatic parenchyma, producing prostatitis. So, flush the urinary system by IV fluids, ultrasonography and radiography if strangury is present, urinalysis or urine culture, CBC, antibiotics, all these are usually done because the main cause, as we see, is urinary tract infection. This is a normal prostate. Just to show a normal prostate. In prostatitis, it will be different, it will be heterogeneous in nature. Urinary incontinence. This is what I wanted to tell you more because this is a technical term which is used by some of our doctors in a wrong sense. The dog is not passing urine, it is having urinary incontinence. Urinary incontinence means it is not passing urine. It is passing the urine continuously without any hindrance. Nothing is there to prevent the urination. No block at all. Continuously without any block. Free flow of urine continuously. That is urinary incontinence. So there is involuntary leakage of urine, we can say. The common causes are chronic urinary tract infections. By this, the sphincters, etc., becomes very weak. There will be continuous leakage of urine. Hormonal imbalance, the most common causes after sterilization surgeries. Oophorohysterectomy in bitches and queens. It is very common. They will put on weight as well as they go with urinary incontinence. Neurological issues, injuries to spinal cord or brain, urethral disorders. It may be congenital urethral disorders with the sphincter, anatomical dysfunctions of the urethral sphincter. Cushing syndrome where there is polyuria. Diabetes when there is polyuria. All these are common causes, and the commonest cause is spaying. How will you manage it? The number one management system is alpha adrenergic agents. That is nothing but PPA, phenylpropanolamine. And this PPA, phenylpropanolamine, is unavailable in India. It is unavailable in our place, and so it can be imported because most of even I have it, and most of the clinics are importing it. The commonest material which is available is proin tablet. We can purchase it from outside. We can import it. It is in a scheduled list. That is why it is not available in India. And other drugs which can be used as adjunctives are ephedrine and phenylephrine. But more than that, PPA is the best. They directly act on the smooth muscle receptors to increase the urethral tone, and maximal urethral closure pressure. See, the same thing happens in human ladies also. Even after menopause. After menopause, the human ladies, even see, why there is a urinary incontinence after menopause in human ladies and after sterilization, bitches and queens. The human lady or the bitch or the queen will not come in cycles. If it come in cycles regularly, the estrogen should come. And due to the influence of the estrogen, there will be maintenance of tonicity of the urethral sphincter. And when there is no ovary, when it is sterile, or when the human lady, she goes menopause, there is no cycles, no estrogen, no maintenance of urethral sphincter tone. So that is the reason. So for maintaining the tone, we can use PPA. PPA should be used BID, is the most effective one, and the dose is 2 milligram per kg BID. It's available as 50 and 25 milligram tablets per annum. Then what about oliguria, polyuria, anuria? How will we say there is an oliguria? The normal urine output in the dog is 1 to 2 ml per kg per hour. And if it is, the output is below 0.27 ml per kg per hour, we can say it is an oliguria. So reduced quantity of urine, that is all. It can be physiological, the cause can be physiological or pathological. Causes of oliguria, we know the lot of causes. Oliguria, no urine at all because the kidney can dysfunction. The main thing is kidney disorders, AKI, acute kidney injury or CKD. Dehydration, there is dehydration, there will be oliguria. Urinary tract infection, especially in human beings, during hot seasons, we will have a lot of perspiration. And all of our lost water is through the perspiration. And water is lost from the body at 20 ml per kg body weight. Through the urine, 20 ml per kg body weight. Through the feces, and 20 ml per kg body weight by perspiration. In the dog, it is by tracheal evaporation, by barking and panting, or in the human beings by sweating. There is no sweating in the dog. Got it? So that has to be applied here. When during hot seasons, will be physiological oliguria. During cold seasons, there will be physiological polyuria. Just opposite to it, there will be physiological polyuria. So dehydration, urinary tract infection, there will be prolacturia, polyuria, etc. Then early kidney diseases, there will be oliguria. Or in early kidney disease, there will be the things are like this, sequence is like this. There will be polyuria, normal urea, then oliguria, anuria. That is it. So, the diseases conditions like which affect the kidneys, like leptospirosis, vector-borne disease like the babesiosis, ehrlichiosis, etc. Then various poisonings, oral poisonings, or malicious poisonings. For example, opioid poisons, heavy metal poisons, then snake bites, etc. can destroy the kidneys. Causes of polyuria. It is an early indication of kidney disease. Kidneys are unable to concentrate the urine, leading to increased volume and diluted urine. In diabetes mellitus, there will be polyuria. Why there is polyuria? There is no resorption of sugar, glucose. It will be excreted through the urine. And so there will be polyuria. In pyometra, it is actually flushing of the body. Drink more water, flush the body to counter the toxic effects, toxemia of polyuria. Pyometra. So in pyometra there is polyuria. In hyperadrenocortic is due to hyperglycemia, the Cushing syndrome. There will be polyuria. Hypercalcemia, in order to excrete more amount of calcium, there will be polyuria. In pyelonephritis, for the normal flushing of the urethral tract or the kidneys, there will be polyuria. Renal glycosuria is a defect in the kidney's ability to reabsorb glucose. Same thing happens in diabetes mellitus also. Medullary washout. This is very commonly seen in human beings. It is a congenital loss of kidney's ability to concentrate urine. Medullary washout. It is not very commonly found in dogs. Anuria means no urine at all. No urine is found. Complete absence of urine production. Acute kidney injury, urinary tract obstruction, dehydration, shock, severe blood loss, heart failure. There is no need for any explanation. It's self-explanatory. All these are the common causes of anuria. You see, look at this urine color chart. So first of all, you can see this. When there is polyuria, there is no color. This is abnormal. This is light yellow. Urine should have a small color. This is a normal urine. Should have a small color. What gives color to the urine is nothing but a xanthochrome pigments. So there should be a small slight color, an amber color, a slight color, a slight light yellow color of the urine normally. When it is a this slide, you can see this light yellow urine means it is abnormal, because light yellow means it is completely diluted urine due to polyuria, and this is a normal urine. You can see it's a good. It is good. Good means slight yellow. A light yellow color should be there. You see, you just have a look in our urine. When we are in normal condition, we can see a slight yellow color. That is normal, because the urine should normally contain a pigment. What pigment gives a yellow color to the urine? It is nothing but the xanthochrome. Xanthochrome should be there excreted in the urine. And when it becomes more dark yellow, we can say it is slightly dehydrated. When it becomes amber colored, we can say it is dehydrated, somewhat again more dehydrated. When it is more brown, it is becoming darker. Becoming brown means it is very dehydrated. When it becomes slightly red, red shade is there, but it is not true red, it is light shade. Red shade is there. This happens to us even in our places, even in Delhi or UP. In the summer seasons, it's 37, 40, 43, 45 degrees centigrade. There will be loss of perspiration will be there, loss of insensible water loss will be more. So we'll have to drink a lot of water. Otherwise, what will happen? The urine becomes more concentrated, and the urine sometimes will be this much red colored. We cannot say the urine is red colored, but it is deep yellow. It is deep yellow colored. It is severe dehydration. We should not go to that range, because that is too dangerous. Then coming to the next slide. See, this is a normal dog urine. Normal, slight yellow color of the urine. And this is the normal color of the urine. Slight yellow color should be there. From this, you should not say that there are bile pigments. Then pyuria. Pyuria, this word meaning itself is pus in urine. Pus in urine. So, but there will not be any pus. You cannot see any pus. But the actually literal meaning is pus in urine, but actually pathologically means pus cells in urine. Normally 2 to 4 or 4 or 5 pus cells will be there in the urine sample. On microscopy in one field there are 2 to 4 pus cells will be there, which is normal. But if there is more than 7 or more than 10 pus cells, it is a clear indication that there is pyuria. It is a urinary tract infection. Increased leukocytes in the urine, ascending or descending infection. It's an infection of the kidneys, maybe the infection of the ureters, infection of the bladder, maybe the infection of the urethra. See, it's all. See, whatever be the infection, wherever be the infection, treatment is the same. Antibiotics, IV fluids, flushing the tract, that is all. See, this is a deep yellow colored urine. Deep yellow colored urine, where it is dehydrated. Here it is hematuria. Hematuria means blood in urine. But as such, you cannot see any blood in urine. But on gross examination, you can see red urine. So the red urine can be of three types. Maybe hematuria, or maybe hemoglobinuria, or can be even myoglobinuria. All these look almost alike. So we have to ascertain. How we will ascertain that it is a hematuria? Hematuria means just non-lysed RBCs in the blood. Urine. Non-lysed RBCs in the urine. So take out the blood urine sample, centrifuge it for 3 or 4 minutes, take out the urine sample. If it is decayed, you can see the RBCs packed in the bottom and the top urine is yellow colored ordinary urine. If it is clear, it is clear hematuria. So you can clearly say that it is hematuria and it is all bleeding wound somewhere inside the bladder or the urethra. It is nothing but stones. Nothing but stones. So we can go for ultrasound, X-rays, etc. for the stones. That's a clear indication, and that is the use of urine examination, hematuria. The common causes of hematuria are urinary tract infections, bladder stones, kidney stones, trauma, neoplasia. For example, the commonest neoplasia is TCC. We have benign neoplasias like the polyps. We have malignant neoplasia like the TCC, translational cell carcinoma. Of course, we know the treatment of transitional cell carcinoma is very easy to diagnose. From the X-ray itself, we will get a small picture. From ultrasound also, we will get a small picture. Take out the urine, examine the sediments. You can see the malignant cells. It's very distinctive, descriptive, self-descriptive. And so the treatment is piroxicam. Piroxicam daily. The treatment is nothing but piroxicam. And BPH, benign prostatic hyperplasia, vector-borne diseases. We have a lot of vector-borne diseases like Babesia. We have bigevina, canis. We have Gibsoni, Ehrlichia. We have anaplasma. We have hemocytosome. Lot of vector-borne diseases are there. And poisons such as warfarin, bromodiolone. Why I am telling bromodiolone? Because almost all the rat poisons nowadays contain bromodiolone. I've got 3-4 cases of bromodiolone toxicity, and this is a slow poison by which it slowly depletes vitamin K. So it is bromodiolone. You have to supply vitamin K for a very long time. So in this slide you can see it's a normal urine. Urine with polyuria. Here is a normal urine where you can see the chondrochrome pigments. Here it is hematuria, and this is hemoglobin. See the difference between the hematuria and hemoglobinuria. This is hematuria. This is hemoglobinuria. Hemoglobinuria will be grossly looking much darker than the hematuria. So when you take the blood sample, urine sample, and centrifuge it, if it is decanting and the topmost urine is clear in nature, it is hematuria. If it is decanting well and RBC trauma is there with the red urine in the top, it is hemoglobinuria. So myoglobinuria, you cannot see any RBC. It is, even after centrifuge, you can see completely dark red, like this is myoglobinuria. So this is how we have to differentiate hematuria and hemoglobinuria. Then hemoglobinuria, the presence of hemoglobin-lysed RBCs. The commonest cause is IMHA, immune-mediated hemolytic anemia. In vector-borne diseases, we know very well. I am also encountering, like you, several times in a week, toxins like warfarin, bromodiolone, etc., venomous snake envenomation, especially vipers. Then heat stroke. Heat stroke is a very common thing. In hemoglobinuria, here also you can see very well. Glycosuria means presence of glucose in the urine. Happens in diabetes mellitus, that's the most common cause. Then the kidney disorders like Fanconi syndrome can impair the kidney's ability to reabsorb glucose. It's not so common in dogs, even though there are 2-3 cases reported. But like just to take it from the textbooks only. Heavy starchy or sugar-rich meal. During stress, there will be stress and the hormones released like the catecholamines, etc. can increase the BGL. Administration of glucocorticoids like prednisolone, dexamethasone, glucomethazoline, etc. This beta-methasone, etc. can be administered, which increases the BGL and the Cushing syndrome, where there is hyperadenocorticism, then rabies. Whenever you find a case of rabies like a droopy tongue, a droopy lower jaw, profuse stinging salivation, and ataxia, etc., you suspect a dumb rabies. So you can catheterize, if it's a male, you can catheterize, if female, also you can catheterize, take some urine or puncture, take some urine and examine for glycosuria. If it is positive for glycosuria, it is a strong indication that it can be rabies. Proteinuria. Proteinuria is seen in kidney diseases, urinary tract. Of course, because of leakage of proteins through the kidneys. Kidney diseases, urinary tract infections, in fever. Okay, in fever, there is breakdown of protein, this muscle fibers. Systemic hypertension can lead to proteinuria, diabetes mellitus, Cushing syndrome, multiple myeloma, glomerulonephritis, protein-losing nephropathies. Almost all these are related with kidney diseases or muscle diseases. So the number one in a veterinary practice, whenever there is proteinuria, 1 plus, of course, we can admit to a certain extent. Even 1 plus should be considered as abnormal. But otherwise, also in a normal animal, if it is 1 plus, we can, okay, suspicious, let it be that it is 2 plus. That means above 100 milligram per ml of urine. It is again a clear indication that it is glomerulonephritis. 3 plus means it is having severe nephritis. Then ketonuria, ketone bodies. Why there is ketones in the urine? Normally, the glucose cannot be utilized due to diabetes mellitus, due to type 1 diabetes mellitus. The glucose cannot be utilized in the dog. Type 1 diabetes mellitus is the commonest. 85% is type 1 diabetes mellitus. The insulin is not present, and so glucose cannot be utilized. Somehow the body has to find a method for energy. For that, proteins will be used. Fat will be brought and burnt. And when all the fat are exhausted, protein will be burnt. And as an end product of protein metabolism, there will be ketone bodies. And excess ketone bodies will be excreted through the urine. We say it as ketonuria. So it is commonly present in diabetes mellitus as well as in diabetic ketoacidosis. It's more severe form of, as you also know, it is more severe form of diabetes mellitus in dogs. Then myoglobinuria. I have already explained about the exertional myoglobinuria in racing dogs like greyhounds, salukis, whippets, etc. They are used for races, especially Arabian greyhound. They are very well used in the Middle East. They will be given rest for during the Sunday and Saturday or for 1 week continuously, immediately taken for a race. Just like in Monday morning sickness in horses. Due to exertion, there will be rhabdomyolysis and there will be myoglobinuria. And sometimes due to direct muscle trauma, hyperthermia. Hyperthermia can cause, high body temperature can cause damage to the muscles. Then snake envenomation also can cause damage to the muscles and myoglobinuria. Then coming to the urine specific gravity, we have hypostenuria, hyperstenuria and isostenuria. Hypostenuria means lower specific gravity less than 1.020. So I have already said that the normal specific gravity of urine can be between 1.020 and 1.050 or 1.070 we can say. Any urine which is below specific gravity of 1.020 can be considered as hypostenuria. It very commonly which is seen in diabetes mellitus and diabetes insipidus, where there is deficiency of ADH. Diabetes insipidus is otherwise known as renal diabetes, where we should have to supplement ADH throughout the lifetime. In kidney diseases, damage to the kidneys can impair their ability to concentrate the urine. And hypostenuria is very common in small pups because their kidney, they are all young kidneys and their ability, see how when the kidney will function to the maximum by 6 months. When a pup is born, the eyes will focus only in 2 months. The ears will focus in 4 months. And the kidneys will work properly in 6 months. So up to 6 months it will be urinating over hither and thither all the time. This is a common problem which our client used to tell us. This is only because of it is a young kidney, it is a normal, in the pup's kidney is normal. It cannot concentrate the urine. And so polyuria or polyuria occurs. It is normal, physiological. And so don't blame the kidneys during that time. And there is no damage in the kidneys. Then trauma to the kidneys, trauma and primary thirst disorders, brain disorders. Then hyperstenuria. See, Cushing syndrome produces hypostenuria. So normally, Addison syndrome should produce hyperstenuria, concentrated urine. When the specificity of the urine is above 1.030, we can consider as 1.030. When it is below 1.020, it is hypostenuria, and below above 1.030, we can say it is hyperstenuria. Just generally, in our clinical practice, we should say above 1.050 can be clinically considered as hyperstenuria. This is taken from the textbooks only. What I consider is 1.050 is upper limit. In Addison's disease, reduced water intake and concentrated urine. And my dear friends, with this, I am concluding my session. And Bharat Mata ki jai, long live our nation. So, now I have completed my webinar, and thank you all for listening to my webinar. Thank you very much.